Hi everyone, this is Dr. Aimee Warren from Catalina Island Medical Center, and today I'm going to be talking about telemedicine. It's important that we're utilizing this modality to stay connected to our patients, but staying diligent with the shelter at home, minimizing our exposure to each other and to the medical center, and decreasing our risk of spreading coronavirus. But with this, patients who have chronic medical conditions such as diabetes, high blood pressure, or patients that might have an urgent care type of concern, it's still important that we're caring for these patients and letting you know that we're still here to help you stay safe, stay well, and we'll go through the ways that you can connect with the clinic providers using telemedicine. So telemedicine and telehealth is essentially just a way for healthcare professionals to connect with their patients in remote locations. So we can utilize different platforms such as phone calls or Facetime, and we'll go through some of those in just a few minutes. So the telehealth services that are available at CIMC are virtual check-ins, which is essentially just a check-in with a provider. Maybe you have a concerning symptom or something you want to talk about that's brief. You can do a virtual check-in, and then we can let you know if it's more appropriate that you have an in-office visit versus a telemedicine visit. We can kind of help you with a virtual check-in if you have a quick question. So we're also doing clinic appointments via telemedicine, and we can do these again via phone call or FaceTime, and you can connect with your provider that way. We're also offering an expanded social services platform via telemedicine. So we've done counseling and therapy via telemedicine for a long time, but we're sort of expanding that, and all of our providers are now doing that. And we're really encouraging the community to take advantage of therapy options that are available. We're all kind of experiencing a heightened sense of anxiety and depression in some patients, and I think this is an important time to pay attention to your mental health, and if you're interested in engaging with social services, that's a great way to do it, and we can help you with that through the clinic. Another option that we're providing through telemedicine is telehealth with physical therapy and or occupational therapy. So this is going to be offered on a case-by-case basis, so it's not going to be appropriate for everyone, but for those that maybe can do Zoom or FaceTime, some sort of face-to-face platform with the therapist, we are offering that on a case-by-case basis. So you can always call and talk to the therapist to see if you're an appropriate candidate. Otherwise, we still want to help you with home exercise programs and a way to stay moving at home with therapy. So which insurances pay for telehealth is also something that I wanted to talk about. So Medicare and Medi-Cal have expanded their coverage for telemedicine, so that's usually covered. Many PPO insurances and HMO insurances are following suit, so a lot of private insurances are also covering telemedicine services. And if you have specific questions about your insurance provider, our billing office can help you with that. So ways to connect via telemedicine. So you can do a phone call, which is easy. If you'd like to do a face-to-face with your provider and you have an iPhone, we can do FaceTime. There's also platforms like Skype and Zoom that we can help you connect with and help you do a face-to-face visit using those platforms. So if you have questions on how to download those apps or get them onto your computer, we're available to help, and you can talk to our IT department about that. So how do you make an appointment for telemedicine? So for a clinic, it's the same way that you always have. You just call the clinic. We're open Monday through Friday, 8 to 5, 8 a.m. to 5 p.m. And the number is 310-510-0096, and we can make an appointment for you with any of the providers. Also for social services, you're going to call the same phone number, the same hours. So Monday, 8 a.m. to 5 p.m., 310-510-0096, and the front office staff will help you set up a social services appointment. So for physical therapy and occupational therapy, if you wanted to talk to the therapist to see if you were a good candidate or at least get a home exercise program, some advice about that, you can call and set up an appointment to speak with one of our therapists, and the number there is 310-510-0700. The last thing I wanted to talk to everyone about was the patient portal. So this is a really great platform that is available through our electronic medical record, and we encourage all of our patients to connect to the patient portal, because that's a great way to connect to your provider for simple questions. So you can send a text message asking a question, or if you need a medication refill, that's a great way to connect to your provider. You can also access your medical records, so your labs, imaging results, anything like that can be obtained through the patient portal. And to connect to the patient portal, if you've been to the clinic recently, you will have been sent usually a text message or an email inviting you to connect to the patient portal. If you did not receive anything, any invitation, you can always call the clinic, and our IT people can help you set up that connection to the patient portal. So again, please call the clinic and set up your telemedicine appointment. Stay connected to the patient portal, and we'll be doing these fireside chats every Tuesday and Friday. So watch out for these every week. All right, everybody, stay safe, stay healthy, take care of each other. Take care.